स्वास्थ्य सेवा निदेशालय के अंडमान निकोबार राज्य आयुष सोसाइटी द्वारा श्री विजयपुरम में स्वास्थ्य विभाग के तहत चिकित्सा अधिकारियों और CHOs होमियो के लिए 3 दिवसीय राज्य स्तरीय पुनरभ्यास कार्यक्रम का आयोजन किया गया है। मातृ एवं शिशु स्वास्थ्य तथा त्वचा संबंधी विकारों के लिए होम्योपैथिक हस्तक्षेप विषय पर 3 दिवसीय प्रशिक्षण कार्यक्रम का उद्घाटन हुआ। टैगोर शिक्षा राजकीय महाविद्यालय के सभागार में आयोजित उद्घाटन समारोह में जीबी पंत अस्पताल में चिकित्सा अधीक्षक डॉक्टर MK साहा मुख्य अतिथि थे। इनके अलावा विषय विशेषज्ञ डॉक्टर शशिकांत तिवारी, डॉक्टर रजत चट्टोपाध्याय, डॉक्टर शांति अधिकारी और प्रशिक्षणार्थी उपस्थित रहे।
Homeopathic intervention of maternal and child health and dermatological disorders. On behalf of Ayush, Directorate of Health Services and Medical Administration, I extend a warm welcome to our chief guest, Dr. MK Saha, Medical Superintendent, GB Pant Hospital, Director of Health Services and Medical Administration, and HOD, Ops and Gynae, NMs. We are deeply honored by your gracious presence, sir. We extend our warm regards with floral greetings. I'd like to call upon
We are blessed to have sir as our chief guest today. First of all, I would like to cordially welcome sir for this 3 days state level reorientation training program for medical officers and community health officers of our homeopathic system under the health department. Likewise, I would like to welcome our eminent resource persons for this training program. First of all, Professor Dr. Shashikant Tiwari sir, who is the former director NIH Kolkata and former principal FMH Medical College Bangalore. We cordially welcome you sir. Then Professor Dr. Rajat Chattopadhyay, who is the principal and administrator of CMH Homeopathic Medical College Kolkata. We cordially welcome you sir. Then I would like to welcome our next resource person, Dr. Santi Adhikari, who is the research officer in charge, CRU, Clinical Research Unit, CCRH, Central Council for Research in Homeopathy, Government of India, Port Blair Unit, Sri Vijaypur Unit. Likewise, I would like to welcome you all who have come all the way from Campbell Bay to Deglipur. Sir, I would like to inform you that under the Directorate of Health Services, we have Ayush as a wing, and under Ayush we have 3 systems functional, that is homeopathy, Ayurveda and yoga and naturopathy. So homeopathy exists in these islands since the year 1975 along with the mainstream modern system of medicine. In 75 there was one homeopathic dispensary, and after that gradually the dispensaries were co-located at various district hospitals, CSCs and PSCs, and at present there are 20 homeopathic units functioning all over the islands, and we have co-located Ayurveda, homeopathic and yoga naturopathy units as per the public preference and as per the guidelines of Government of India under our UT scheme, then central schemes like National Health Mission and National Ayush Mission. So all the doctors have come from various islands for the reorientation training program. This program, the topic has been chosen as a homeopathic interventions for maternal child health and dermatological disorders particularly. So I appeal all the my colleague doctors to reap the benefits from the very resourceful training program. I once again welcome our esteemed dignitaries on the dais and all the participants. Thank you.
I invite Professor Dr. Shashikant Tiwari to kindly say a few words and inspire us, please. Glad to announce that last year he has been awarded with the prestigious Professor Emeritus Award by Rajiv Gandhi University of Health Sciences, Bangalore, and many more Achievers Award as well. He has authored innumerable books, to name a few: Essentials of Repertorization in Homeopathy and Child Care, and presented various scientific papers in national as well as international conferences.
That I have been invited to this island for orientation program to the medical officers of Ayush. I am very happy to know that there are 20 medical centers, units functioning under Ayush, and all young people have taken up as a job medical officers, research officers, and in community health centers. Actually, this aspect of health, which is care by homeopathy, is holistic care. And we slightly differ in our case taking and in our treatment to the person. For example, I will tell you, if a patient comes with a headache, we have to find out what is the cause of headache. It's not just painkillers we can give it, but we have to find out the cause, we have to find out the personality, the constitution of the person, the mental makeup, the physical makeup, and his aggravations and ameliorations of the headache. Considering all, we give single medicines which cures the patient, not only relieves the pain of the headache. So these are few things which is a speciality of homeopathy, and we will discuss a lot of things about homeopathy in our discussion. Let me say that this is a very good place. I went around and I have some students here, even Dr. Nazma is my student from Father Muller's, and there are many others who have completed from Kolkata. So I was very fortunate to be a teacher in homeopathy, because being teacher is something, a very honored profession, which also helps to spread the subjects, as well as you can guide people in your system of medicines. So being here, I am very happy. I am happy and I am very thankful to Dr. Manvika, who has invited me, and she has taken care of many other programs other than the training. Yesterday we went to the cellular jail and we saw the music and light show, and many other programs he has also fixed it. So I am very happy to be here. This is a good place, very healthy place. You may not get many patients, I think. I was wondering whether there are any patients at this island. But if they are there, please take care of them and treat with homeopathy, practice homeopathy. Homeopathy has a lot of potentials if it is practiced on principle.
Professor Dr. Rajat Chattopadhyay has done MD in Organon of Medicine from National Institute of Homeopathy, Kolkata, and he has been awarded the Order of Merit by University of Calcutta and ranked first during his MD course. He has authored quite a number of books. To name a few, a complete book on cardiovascular system for homeopathy, another one, Man in Changing Environment, Simplicity of Homeopathy. He has a notable number of papers to his stride, accepted in national as well as international conferences. Some of the papers, topic, Homeopathy on Mother and Child Healthcare in the year 2007, and in the year 2009, Understanding Basic Research Methodology on Homeopathy. There are so many others. Because of shortage of time, I couldn't compile all together. So in the rest session, I will be telling you all. May I have the honor of inviting you, sir, to share your valuable insight, please.
First of all, it is my proud feeling to be here within you. And right now, homeopathic system of medicine is in transitional phase. Here it is nice to hear that from number 1 from 1975 to 2025 it is now becoming 20, or through RBSK or all other system now homeopathy has entered within the mainstreaming. So there are so many centers and will be opening. I am sure that under the leadership of our Prime Minister, the Ayush Ministry, it is already here. So there will be lot of more centers, sub-centers, and the mainstreaming of Ayush will be happening also here like all over India. But we are going through the very transitional phase. The syllabus curriculum of the BHMS, MD, PhD all have been changed. New curriculum just catching the tune of the present context. Now even within this year from 2025 after MD, DM is also, you know that PhD is also here, but after MD, DM is also will be starting in the 4 or 5 subjects by Government of India from this year. So lot of things new, and education, research, practice and good homeopathic practice is the right now it is identified that good homeopathic practice, because good homeopathic practice and as homeopathy, considering the principle of homeopathy, if good homeopathic practice can be done, then can only be not only practitioners, good researcher will also come out, because we have very huge research database also, huge, more than 400 centers all over India. So good education, good research, good practice is the motto. And Andaman Nicobar, this island, I think you have a very good advantage here, that till if you compare with metropolitan cities like Delhi, Mumbai, Kolkata, or any Bangalore, Hyderabad, the peoples here are not so many contaminated, like polluted like that. I know pollution is also here, contamination is also here, but mixing still you can find here the patient where homeopathic medicine can act, the researchers can do without, in comparison, much less polluted field. So the research unit is also here. So we can expect that lot of research work through you practitioners, because the practitioners will only can give the true data, and the basic thing of any research or any new thing is the transparency and trustworthiness. And that trustworthiness, that transparency can be done from these islands where peoples are very innocent, simple, benign natured, and you as a homeopathic physician, you have enough responsibility to treat them and to give all those data to the researchers, so that new thing, new medicine, new type of explanation can be come out, because nowadays the era of epigenetics is going on, and homeopathic system of medicine is based on this epigenetic system. I will not take much more time. Chief guest is here, so we will have a better talk during.
Again, to share our views, my topics as given by the organizers. Though I am little bit nervous as well as proud to share the same stage, because of my both beloved teachers and eminent personality, I learned lot of things since my BHMS. They inspired me throughout my BHMS career along with MD and then post MD, all those things continue inspiring, and I am also lucky like you to share and to get opportunity to learn from their insights, all those topics. I will also deliver on my topics definitely at my best of level. Hopefully all you are enjoying, and at the end these workshops will be more insightful and more engaging. Thank you all.
The goal of this program is to empower homeopathic doctors with enhanced skill for managing maternal and pediatric health conditions, to promote deeper insights into homeopathic treatment of dermatological disorders using holistic approach, and to bridge traditional knowledge with modern advancement, fostering evidence-based practice that align with public health initiatives. I'm sure we are all getting ready to dive deep into the interesting topics. Ladies and gentlemen, it's our pleasure and privilege to invite our esteemed chief guest to address the gathering and inaugurate the 3-day-long state-level training program for the medical officers. We'd like to hear from you.
I am more than certain that my speech will get eclipsed by the nature of, by the amount or quantum of knowledge that they possesses on this fascinating branch of medicine. There is no element of doubt whatsoever. And more so, since I don't belong to homeopathy per se, I am an obstetrician. So obviously the moment this offer reached me, I took it heartily because it has everything to do with the profession that I deal with, the maternal and child health in particular. Okay, although dermatology has been added, obviously. When I was going through the brochure, I was impressed that so many topics will be covered during these 3 ensuing days. Indeed, just to quote Professor Tiwari about the teaching profession that you were saying, it reminds me that teaching is nothing but sharing enthusiasm. And I'm just quoting from a book actually, which is very dear to my heart, that a teacher's greatest contribution is achieved when his pupils know more than he does himself. A teacher's greatest contribution is achieved when his pupils know more than he does himself. I'm sure Professor Tiwari will be at one with that statement or quotation. Okay, in my branch of obstetrics, there are many elements that we find sometimes difficult to deal with, particularly at the beginning of pregnancy when the organogenesis takes place during the first 13 weeks of pregnancy. And we obstetricians are a great deal skeptical about advocating any medicine, keeping in mind the fact that most of the medicines are detrimental and may even cause teratogenic effect. But when I was told that homeopathy has got very many medicines which deals with these common symptoms of morning sickness and all those things, and so I was impressed that in fact it's good that we have something like this. And moreover, homeopathy is known to have virtually no side effects whatsoever. So that is one most fascinating thing. There are many other branches that homeopathy deals with. I personally, being an allopathic doctor, I was not so fascinated with homeopathy, to be honest. It's my honest confession. Until a few months back. In the month of July, I was badly struck with chikungunya. I was incapacitated, almost in bed. But barely I could recover from the drawback and the side effects of chikungunya, particularly the lingering joint pains and all. I was struck by a nasty respiratory distress, breathing problems. And over a period of time, even though I used everything, not excluding steroid even, and despite all these bronchodilators and whatnot, nebulization, at one point of time I was so crippled that I could barely sleep for days together. It was then one of my friends who is having a flourishing practice here in Andaman. She advocated me that she got a remarkable relief from her ailment by homeopathy. So I readily accepted it, and I went to a renowned homeopathic physician here in Andaman itself, and you won't believe it, the miraculous relief I got from the medicines that I will never forget ever in my life. And from then on, to be honest, I have become a great fan of homeopathic medicine. I honestly, it is all this what I am saying is not to impress, but every bit of what I am telling is true to the hilt. I am still taking homeopathic medicine, by the way, in order to prevent any recurrence of that kind of crippling disease that I was afflicted with, to be honest. So, it is high time that we propagate this branch of medicine far and wide, and thankfully, as we know that as many as 20 centers are there where there are Ayush facilities there. Maybe over a period of time, the network will increase even further. I am sure that people of this island will be greatly benefited by this fascinating branch of medicine. With these few words, I would like to conclude. Thank you very much for your patient hearing.
May I now call upon Dr. Kirtika Chandar, Medical Officer, Homeo from Ayush Hospital, to please deliver her vote of thanks.
On behalf of the entire training program team, I would like to extend my sincere thanks to our esteemed chief guest, for gracing this occasion with his presence. Thank you, sir. I would like to thank all our eminent resource persons for accepting our invitations readily. We are fortunate to have them with us today. Let's make this training program an excellent opportunity to refresh our knowledge and to explore innovative approaches. I would like to thank our Deputy Director Ayush for his unwavering commitments and guidance in designing this program. I would also like to thank Medical Officer in Charge Homeo, Dr. Manbika Datta, for her endless hard works to make this training come true. She has taken care of every minute details of this training program. Thanks to all our enthusiastic participants, all medical officers and CHOs from various units for attending the events of learning. Excited to embark on this transformative training experience together. A special thanks to all the dedicated organizing committee who has worked tirelessly behind the scene to ensure every minute details was perfect and bringing this event to life. A big vote of thanks to everyone who made today's inaugural ceremony 3 days training program such a resounding one.
With this we come to the end of the inaugural session. The training program has brought us all together and onus of carrying the campaign is on us now. Let's remember that when we come together with a shared purpose, we can create a brighter, healthier and happier future for everyone. With these words, we conclude the inaugural session of the 3-day state-level reorientation training program of the medical officers. Let's make this program a successful, impactful, fruitful and memorable one. Thank you. All are requested to proceed for the high tea. But before that, I would like to inform you all about the schedule. The training sessions will run from 9:15 a.m. to 4:30 p.m. each day with short breaks in between. Kindly refer to the program schedule given in your file for session details. For any assistance, our organizing team will be happy to help you. All the trainees are requested to be seated by 15 minutes from now. So with this, a big thank you to our chief guest, our guest of honors, our resource person and each and everyone here. Thank you.